Hello friends, it's me again, and today we will be talking about how to improve your hearing. So, let's get started. 1. Getting your ears examined. See your doctor about your hearing problem. If you've noticed a reduction or change in your hearing, schedule an appointment with a healthcare professional so they can examine your ears for any obvious abnormalities and ask you pertinent questions about your history and lifestyle. Most problems that negatively affect hearing are benign and reversible, so don't be scared to seek professional opinions. Combating sensorineural hearing loss, SNHL. Understand that SNHL can't be reclaimed naturally. Although you can't attain normal hearing via natural ways or home remedies if you suffer from SNHL, advances in medicine and technology can certainly help your situation. Get a hearing aid. A hearing aid is a small electronic device that is worn in or behind the ear. They make some sounds louder by magnifying sound vibrations entering the ear. A hearing aid has 3 main parts. It receives sound through a microphone, which converts sounds into electrical signals and sends them to an amplifier, which amplifies them and sends them to the cochlea through a tiny speaker. The sounds then cause little hairs to move within the cochlea, which stimulate nerves to send messages to the hearing center of the brain. Get a cochlear implant. If the hairs within your cochlea are too damaged due to an infection, tumor or head injury, then a hearing aid will not be of much use. Instead, you will need an invasive operation called a cochlear implant in order to regain functional hearing, which is an electronic medical device that does the work of the damaged cochlea to provide sound signals to the brain. Schedule a surgical procedure. Surgery may be needed to drain an inner ear infection, remove a tumor or reshape a genetic malformation in order to help restore hearing loss. Keep in mind that any surgical procedure carries risks, so be well informed before choosing this route. 3. Combating conductive hearing loss, SNHL. Clean out your outer ear canal. Blockage by earwax or other debris is a common cause of SNHL. Earwax is healthy in small amounts and has protective, lubricating and antibacterial properties. Most of the time the ear canals are self-cleaning, but sometimes they become clogged or impacted, which causes partial hearing loss in addition to sensations of ear fullness, itchiness or ringing. Tinnitus. Cotton-tipped applicators are not recommended for cleaning deep into the ear canal, so consider safer methods such as placing a few drops of mineral oil, baby oil or glycerin into your clogged ear. Clear out your eustachian tubes. The common cold, sinusitis and allergies can clog the eustachian tubes, which connect the middle ear with the upper throat and nasal cavity, with fluid and mucus, leading to ear pain, popping sensations and reduced hearing. Blocked eustachian tubes often get better without attention, but to accelerate their clearing, try closing your mouth and holding your nose, then gently blow as if you are blowing your nose. Consider the use of antibiotics. Antibiotics destroy or inhibit the growth of microorganisms such as the pathogenic bacteria that can cause inner and middle ear infections. If your doctor diagnoses you with an ear infection, then an antibiotic such as amoxicillin might be helpful and help restore your hearing. 4. Practicing exercises that improve hearing. Enhance your hearing with exercise. If you don't suffer from either SNHL or SNHL, but simply want to improve your hearing, then engage in regular cardiovascular exercise because it helps with blood circulation and fine-tuning within the ear. Practice noise filtering. Play music at relatively low volumes while having a conversation with a friend. Add a second source of music and then a third source while continuously focusing on the conversation. This will train your ears to filter out ambient sounds. 5. Changing your diet. Eat foods that contain nutrients needed for good health and normal ear function. Examples of such food include cold water fish, herring, salmon, trout, most nuts, seeds and whole grains, and virtually all fresh vegetables and fruits. Avoid foods that may make a negative impact on hearing. In addition to adding certain foods for health benefits, removing certain foods from your diet may yield health results and better hearing also. Avoid heavy metals such as mercury, arsenic and cadmium. Heavy metals are toxic to nerves, especially small ones like those which innervate the inner ear, and ultimately destroy them. The body can't rid itself of heavy metals very well, so they build up with time and become more dangerous. 6. Preventing hearing loss. Take measures to stop further hearing deterioration from loud noises. Although you can't reverse SNHL, you can take steps to keep it from getting worse. For example, reduce your exposure to loud and sustained noises and wear earplugs if exposure is unavoidable. Protect your ears from sharp objects. Never stick a sharp object into your ear. Sticking a pin, pencil, knife or other sharp object into your ear may perforate your eardrum and lead to permanent hearing loss. Consider the impact medications might have on your hearing. Although some medications are clearly life-saving and needed on a regular basis, others that deal with minor symptoms such as headaches may be negatively impacting your hearing. Treat other health issues promptly that may otherwise impact your hearing. Don't let your cold, flu, sinus infection or allergies get out of control or become chronic recurring, such that it impacts your ears and reduces your hearing. Keep your immune system strong so that it can naturally fight off infections. Thanks for watching. If you liked the video, consider subscribe. Thank you. Bye.